Well, hello everyone. This is Dr. GERARD CUOMO. First of all, I want to wish everybody a very happy March 22nd. Weather here in Florida is going to be up around 81 today. We've got a little rain coming, but boy, our summer is already here down south, and I'm sure it's pretty warm everywhere else in the U.S. Little different. I'm here with Oleg's case, and we're going to go ahead and try in our final work. It's a porcelain fused to metal crown, real strong crown for his bite. And first things first, we're going to just talk about where we are. Last time we showed a video of his tooth preparation design, and we placed retraction cord, went ahead and took our impression, made our temporary, and so this is the final step. So his temporary was a little loose, only because he chewed some gum, and but admitted to it. So he kept it in, but we noticed that he did have some washout. Now this was, as I believe we placed this with Duralon cement, but you can see the underside of that, but held up real well. Nice tooth. This tooth has a history of having to have a root canal, and so we're moving on to our next steps. Now we're going to come around and place Siltrax cord. Notice he's got some slight inflammation on that distal, and that's a bit of a challenge. So let's take a look at the distal aspect of our tooth. There it is. So you can see just slightly red color, so we'll recommend water picking, obviously in that area, and also flossing. That's where our margin is. There it is on the mesial. Alright, so next step, we'll take Siltrax number 7. It's a braided cord dipped in Hemodent. And I want to do a shout out to those FAU students out there, the Pre-Dental Society. They're watching this video. Good luck with all your classes, and good luck with getting into dental school. And those of you that got accepted to dental school, congratulations. I'm now teaching at FAU on Friday mornings a pre-dental hands-on class that is 10 weeks in duration. So we have a nice hands-on setup. Do go to my Facebook to see some of the photographs there that have been put up. We've got a video that's going to be put up soon too as well about the course. Great people at FAU, Florida Atlantic University, warm welcome, and certainly many thanks for having me aboard. Alright, now we're going to get down to that distal aspect, and I'm placing retraction. I'm just using a simple long explorer as I flip from one magnification to the next. So let's go back to there. Up about 12.5 mag right now, and we're going to use a smaller instrument called just a small explorer after I just tuck this all in, and you'll see that the instrument I'm going to use is just the right size. Alright, so we'll get that small explorer now. I got it right here. And then we're going to use something called microsuction, so that's next. I like microsuction because it allows me to get into the real tough areas of the mouth. Not so easy to use suction, and we want to get a real super dry field. Hey, that's the way to go, microsuction. Used a lot in endodontics. I just like the idea that I can get in and use it to my advantage. So there we go. Hold that hose for me. Okay. Alright, next step. Right after this we'll take, might have to turn it on. Let's see. Let's check that again. Ah, there it goes. See how it just dries out that cord nicely. Now we still have to remove some cement off the tooth. I'm going to use an ultrasonic for that. But let me just see that cord in there. It just needs a little more tucking. Hold that. Just slightly. A little more. It's a pretty critical area. You got to take your time with it if you're doing it right. Now I'm going to use a Long Explorer from Hugh Freedy. So it's a little nicer instrument. We can get in there. There we go. How you doing, Oleg? All right? Good. Yeah, the key to this whole exercise is to get some cotton underneath the lip of the margin. So when we go to cement, you have that ability to remove this cord along with any excess cement. Otherwise, you'll be at it all night trying to figure out how to get that cement out of there. And a lot of it goes unnoticed and then until they reach hygiene, and then they have a pocket that forms. So you get it now, make it an easier day in hygiene. And we're going to go with large suction. And I'm just going to snip off the tail of that Siltrax. So we'll just get rid of that. How about that? Got that out of there. And then we'll tuck in that little end. And now we've got something that's buttoned up nicely. Now switch back to my power. And we're going to go ahead and take an ultrasonic. And we'll just lay that up like that. I use ultrasonics from Cavo. Works really well. It's called Soniflex. And they're individual handpieces, so we just leave the tips on them and just autoclave the whole thing. Alright. Alright, close a little bit. We use a lot of ultrasonics in the office, also for post removal. But routinely we clean cement with this item. I love it. It works great. And we'll even contour the tips. Okay, so, you know, I give Oleg about maybe a BP plus on take care of his tissue. I like to see him use the water pick a little bit more on the distal. So I think we're good to go here. This looks great. I'm going to come back in now with his crown and we'll try that in. Alright, so we've got our dye work. And you can close the rest a little bit. Here's our crown ready to go in. We've already fit checked it. We checked his occlusion. And we like broad contacts. We want to make sure the margins all are good. And finally the occlusion. So that's my checklist for the lab. Believe we did not have to send his case back to the laboratory at all. We're also going to look at color as well. First and foremost, the fit of the crown. So we'll slide this in place, and then I'm going to go ahead and do the checking with floss, etc. You won't be able to see that, but I'll do that, and then when we come back at our next video, I'll show you how we cement this in place. So this is Dr. Jerry Cuomo. We'll see you next time. Keep watching.